Flexion abdominal position, elbow abduction, adduction. In the flexion abdominal position, hips facing the wall, she rotates her body around, bringing her feet level with her knees on the wall. Her butt's about 6 to 8 inches from the wall. Feet are hip width apart, knees are hip width apart, trying to keep that space so that we have the kinetic chain from the ankle, knee, hip, all the way into the shoulder established. And so resting in that position, arms are out at a 45-degree angle, palms up. In this position, we have a little thoracic extension. We're posterior rotating the pelvis, and we're putting the hips and encouraging deep hip flexion. So she's going to bring her knuckles to her temples, so the tips of her finger are touching the pads of her hand, and she's going to bring her elbows together, give a little squeeze, then pull her elbows back down towards the floor, and together again, nice and slow, and back down. As she brings her elbows back and down, she's getting a little bit more thoracic extension. We're repositioning that shoulder blade, so that scapula is gliding back and forth through the abduction, adduction, and all the muscles around it are kind of being lengthened and nourished, creating a lot of deep microcirculation while we reposition that joint. And she's going to repeat this as her therapist has prescribed. And this is flexion abdominal position, elbow abduction, adduction.